And we'll have joining me to discuss 4 months of COVID-19 in Nigeria and the government's effort to contain the spread is a public affairs analyst, Ambrose Igwekwe. Thank you so much for joining us. How would you describe the milestone or our milestone in the race to flatten the curve of the coronavirus in Nigeria so far?
Well, Nigeria have done well. We must recognize the fact that at the initial stage, people were confused, just like any other country in the world. Nigerians were confused on the dynamics of the COVID-19. But after a while, we caught up with the rest of the world, having registered the first index case, and then we started doing all the social protocol that the World Health Organization has told us to do. And of course, the Presidential Task Force was inaugurated immediately, and then we started having the daily briefings, and then the states have started to do what they have to do. But we must single out Lagos State for taking the initiative, because even when the federal government was not ready, the Lagos State government was able to be the trailblazer and showed the direction to go. So we must commend the government of Lagos for showing the way before the Presidential Task Force came into being. Having said that, we have come a long way. We did the social lockdown, we did the isolations, we did the quarantine, all those protocols that was put in place by the World Health Organization. Now, for the first 4 months, we have lost a lot in terms of the economy. The death rates have also increased. Nigeria has taken its own share of the fatalities from COVID-19. Even the highs and the lows. So for the first time, we find that our borders have been locked. Not even during the Biafran-Nigerian war was the aviation populated the way it was in COVID-19. So it's a novelty for a lot of nations, and Nigeria is not separate. But again, where we have not really, in the last 4 months, taken a look at is the issue of looking for cures, solutions, homegrown solutions towards the curative, nature of the pandemic, the COVID-19 itself. We have not been able to look inward to say, how do we solve it in terms of cure, if it has no cure, in terms of managing the symptoms, or in terms of vaccinations. So these are the things that we are not ready. We are just waiting for the Western nations to tell us what to do about it. So that is the area where we have found wanting, even till date.
Right.
So
I would just then say, let me just quickly take you on that before we move to another line of thought. How would you then say that the government has been reacting, the body language of the government, reacting to some of the Nigerians, the professors, the herbalists who are claiming that they have something that could help us manage, if not totally, cure this virus?
I am completely at loss on the stance of the Nigerian government on this, because a lot of people have come out. We know that in this kind of cases there may be pretenders, but we have some solid research people who are into pharmacology and pharmacy that have come out, who are into biotechnology that have come out. We can give examples of Professor Maurice Iwu. We can give examples of Reverend Father Dr. Anselm Adodo. We can give examples of 1 or 2 other people who are practitioners in the field, who have been proven their track record is not in doubt. I wonder why the government is not looking in that direction. People like Father Anselm has come out to even say that he has submitted his recipe to NAFDAC, and the NAFDAC have not come out to say anything. This is almost 3 months down the line. What has happened to what Professor Wu also submitted to them? Now we sit down and we're waiting, but we're quick. The federal government, the PTF, was quick to announce the drug that was just discovered 4 days ago from the Western nations. So I think that it's either we're under instructions from the Western nation not to accept our own local remedy, or that we are what we are. We celebrate Western innovations and ideas, and we kind of disrespect our own and don't want our own to grow. We have no homegrown solution as we speak.
All right.
And we have said, as researchers have said, the homegrown solution is present. So way forward that the government should actually look into these homegrown solutions and then perfect it so that these things can be available for all Nigerians.
All right. In your opening remark, you mentioned the issue of it affecting our economy as well. But then do you think we have the exit strategy to get out of this quagmire we found ourselves as a result of this global pandemic, which has really ravaged our economy to a very devastating level?
Well, for now, the exit strategy is we are borrowing our way through it. First of all, just a few days ago, the World Bank approved some post-COVID-19 economic package, So we have not been able to get out of it yet. In fact, the states are still on lockdown as we speak. So we are still deep into the economic imbroglio of this COVID-19, and we have no exit strategy. But I'm aware that the federal government is looking forward to doing a midterm, creating a midterm policy and also a long-term policy in terms of 2025 and 2026, 2050 vision. In that way, we can begin to plan, putting into post-COVID era. But one thing is very clear, that we cannot have it the way we used to be. There have to be a change in our system in terms of even generating revenue, in terms of the way we do business, in terms of the economic policies. Because oil, before the crude oil will get to the state of sustenance, will not be very difficult. So the divergence of the economy, the diversification of the economic sector, as we have said, is no more going to be mouthed in theories and policies, but now that's supposed to now be practicalized.
Right.
If we have any sign of exit of this economic imbroglio we find ourselves in.
Well, ask any Nigerian, they'll tell you really want to see an end to these in earnest. A public affairs analyst, Ambrose Igbokwe, thank you so much for your thoughts.